In this lecture, we will discuss hematocrit and packed cell volume, or PCV. So hematocrit is how many red blood cells you have in a given blood sample. We have a few mathematical values that we will be providing you, and it will be your job to determine the relevant information to solve each individual problem. So the first thing you'll need to do is determine the total height of the sample. This will probably just be given to you. We're not going to ask you to bust out a ruler and actually measure these for yourself. Step number 2 is measure the height of the hematocrit. Again, this value could very well just be given to you. Your job will then be to take those numbers and divide the hematocrit by the total height, and then multiply by 100 so we can actually get a percentage. So for example, if we have a total height of 50 millimeters of blood, and 25 of those millimeters are the hematocrit, or the red blood cells themselves, then 25 divided by 50 would be 0.5, and then we multiply by 100 to give us 50%. Okay? Now, this one was pretty easy, right? 25 over 50, that's half. Okay. Sometimes it's not quite so easy. So you can also calculate some of the other parts of your blood. So remember, your blood is your plasma, your white cells and your platelets, and your red cells. So we've got that plasma layer, that buffy coat, and that hematocrit layer. You can calculate some of these other values if you've been given enough information. So sometimes we will give you the total height, okay, and we'll give you the hematocrit, and that's it, right? So like this problem, easy, no big deal. Sometimes we'll give you a little bit more information. So sometimes we'll give you the total height, the percent hematocrit, and maybe the buffy coat. Okay, so the only thing at that point we wouldn't know would be the plasma. And we can do a little bit of math, and we can determine the percent plasma as well. Okay, so let's try a couple extra practice problems. Okay, so jot these down. Okay, pause your video, see if you can calculate these on your own. Okay. When you're ready, come back, let's check your geniusness and see if we need a little bit more practice or if we're ready to move on. So go ahead and pause your video. Okay, so you've paused your video. Let's check our work. Okay, so for number 1, total height is 90 millimeters. Your hematocrit is 40 millimeters. Your buffy coat is 1 millimeter, and your plasma is 49 millimeters. So notice we have a couple extra pieces of information in this practice problem. So first thing, what is the percent hematocrit? So how are we going to calculate that? We're going to take the 40 millimeters of hematocrit, and we're going to divide by the total height of 90. Okay, so 40 over 90 times 100 to get that percentage would be 44.4%. Okay, please feel free to round to 1 decimal place. Okay. Now the next one asks for the buffy coat, so we would do the same thing. Okay, so the buffy coat was 1 millimeter divided by the total height was 90. Okay, so 1 divided by 90 times 100 for the percent would be 1.1%. And then last but not least, the plasma. Okay, we have 49 millimeters of plasma divided by our total of 90, multiplied by 100 for our percent, and that will leave us with 54.4%. Okay, now with your rounding and things like that, if this doesn't equal 100% right on the dot, it should be really, really, really close. And so this should be, let's see, this should be what, 99.9%. Okay, so just rounding, you guys. All right, the next one. Now our total height is only 80 millimeters, buffy coat is 2 millimeters, plasma is 45 millimeters. Okay, but our first question asks, what is the percent hematocrit? Well, that wasn't actually given to us in the problem, but because we are geniuses, we can determine this for ourselves. What are we going to do? We're going to do a little bit of subtraction. So if our total height was 80, and 2 of those came from buffy coat and 45 of those came from the plasma, what is left? Okay, that would leave us 33 millimeters left for the hematocrit, divided by the total height, which would be 90. We multiply by 100 to get a percent. That leaves us with 41.25%, or again, if you only want to round to one decimal place, 41.3%. Okay, so again, how are we doing this? What are we doing? We are just doing a little bit of subtraction. Okay, so if our total is 80 and 2 come from buffy coat, 45 come from plasma, what would be left to be the hematocrit? Okay, that would be a 33. Okay. All right, so the percent buffy coat that was given to us, so 2 millimeters over 80 times 100 would be 2.5%, and then our percent plasma would be 45 millimeters over 80 times 100 for percent, 56.25%. You'll notice, because math says so, we do get a good old 100% this time. All right, so we figured out how to calculate percent hematocrit. And again, what is hematocrit? It's how many red blood cells you have in a blood sample. Okay, so there are things that can affect the percent hematocrit. Okay, we have certain things that will increase your percent hematocrit, some things that will decrease your percent hematocrit. So increased percent hematocrit, you could be dehydrated. Okay, how is that going to affect how many red blood cells that you have? Well, it's really not. What are you messing with there? Well, if you're dehydrated, okay, you are missing a little bit of water, right? You're a little short on water. Well, where do you find a lot of water in your blood? It's in your plasma, okay? So your plasma percent might be a little lower than normal. So it looks like you have higher than normal, or well, higher than it used to be, hematocrit levels. Okay, so we can affect your plasma levels. Okay. Polycythemia, which is the production of excess red blood cells. So you could literally just make extra red blood cells to increase your percent hematocrit. Makes total sense. Okay. Heart and lung disease. Okay, now what are we talking about? Now what are we doing? What is the purpose of all those little red blood cells that we keep talking about? It's oxygen transport. Okay, if we are unable to transport those red cells and that oxygen as efficiently as we used to be able to, or if our oxygen gas exchange abilities aren't quite as good as they used to be, then your body thinks that, maybe we should make some extra red cells to compensate for that. Okay. And then high altitudes, pregnancy, blood transfusions. So the high altitude goes back to there's not quite enough oxygen in the atmosphere when you get to high altitudes. So your body compensates by making more red blood cells. Pregnancy and blood transfusions, you're literally adding more red blood cells to your total volume. So that would also increase your percent hematocrit. We can also decrease percent hematocrit. We could have some sort of anemia. Okay, so fewer red blood cells than normal. Okay. You could have some sort of leukemia or lymphoma, which means you would be making more white cells than normal. So you would be increasing the buffy coat percentage, which makes it look like the hematocrit percentage is a little bit lower. You can have vitamin or mineral deficiencies that are required for red blood cell production. Okay. And then just overall blood loss, if you literally have fewer red cells than normal, that would clearly decrease your percent hematocrit as well. All right, so we're going to do a little bit of practice. You have your chart. I want you to go ahead and pause your video, fill this chart in. When you're ready, let's come back, let's check your work. Go ahead and pause your video, do your work. All right, let's check your work. Here we go. Okay, so this should have been fairly easy. Every total height was 100, which always makes everybody's lives easier. Your height of your red blood cells And then you've got your height of your buffy coat, and most of these are pretty easy as well. Okay, so what is your percent hematocrit? It's your red blood cells over your total blood volume, or your total blood height, I should say. So 48 over 100 is 48%. 44 over 100 is 44%. Okay, so 55%. And we just go down the line. Okay, those values have not changed. Same thing with our buffy coat. Okay, our buffy coat, 1 millimeter over our total blood volume would be 1%. And the only one here that is different is way down here. This would be 0.5% because our buffy coat was only 0.5%. Okay, so this should have been pretty straightforward. Okay, so we had our values. We filled in our table. Let's figure out what everything means. So your hematocrit value for the healthy male living at sea level in Boston, what was that percentage? What was that value? It was just 48%. We got that straight from the chart. Same thing for the female living at sea level in Boston. What did our chart say? 44%. Were the values within normal range? Yes. Okay. So normal hematocrit varies between males and females slightly. Okay, and our last question here, or our last statement, just says describe the differences. So why is the male percent a little bit higher than the female percent? One of the main reasons is that males tend to physically have more blood in their bodies than females. Okay, so if you physically have more red cells in your body, then your percent hematocrit would be a little bit higher. Check your notes for the normal values, the normal ranges for hematocrit for both males and females. You will want to keep that that information in the back of your mind. All right, let's go through the rest of our table. All right, so hematocrit value for healthy male in Denver, we got 55% on our table. For the female living in Denver, we got 53%. Okay, how did the values differ from Boston? Well, they were higher. Okay, these were higher percentages for Denver versus Boston. So describe the effect of living at high elevation on a person's hematocrit. Higher elevation leads to increased hematocrit. So we talked about the higher elevation, okay, on a person's hematocrit. So higher up. All right, in Denver, if you've ever heard anybody talk about Denver, maybe you've been to Denver personally. Denver is the quote-unquote mile-high city. It is, in fact, pretty high up there compared to sea level. Now, with that comes decreased oxygen availability in the air that you breathe. So when somebody first moves to Denver, their body, it's going to take their body a while to get used to their new atmosphere. So what does your body do? Well, your body can't exactly, increase oxygen production in the atmosphere, right? That's not what we do. We take in oxygen. We don't make oxygen. But what your body can do is make more red blood cells to pack as much oxygen as humanly possible into those extra red blood cells when they can get their hands on it. So your kidneys, bless your little kidneys, they're busy. Your kidneys will notice that your blood oxygen levels are a little bit lower than they used to be. And so your kidneys will release EPO, erythropoietin, and it will stimulate erythropoiesis. We're going to start cranking out extra red blood cells. Those extra red cells are now available to take in any extra oxygen that we might be able to breathe in from the atmosphere. Again, we're going to take it when we can get it, and we're going to hold on to it into our bodies with those new red cells. All right, describe how the kidneys respond. We just did that. So the less oxygen causes increases in EPO secretion. We're going to crank out more red blood cells. This would ultimately increase your percent hematocrit. All right, almost done with this chart. Hematocrit value for male with aplastic anemia, that value on our chart was 19%. What about the percentage of white blood cells for our aplastic anemia patient? 0.5%. Are the values above normal? No, they are fairly low. So aplastic anemia, what's happening? Your body has suddenly become incapable of producing blood cells like it once could. And this is both red cells and white cells, okay? So all formed elements, you have dramatically decreased production of those. So our normal value for a male can be up in the mid to high 40s, okay? Buffy coat is normally around 1% or so. So we've got a slight reduction in the buffy coat with the white blood cells, but we have a fairly dramatic decrease in the hematocrit value for our aplastic anemia person. And then we have our hematocrit value for our iron deficiency anemia suffering female. That value from our chart is 32%. Is this value normal? No, it is also lower than normal, so we have fewer functional red blood cells due to the lack of iron in the body. If you remember, iron is a component of hemoglobin molecules, so if we don't have enough iron, we can't make enough hemoglobin, so our red blood cells don't function quite normally. Alright, so now that we've gotten really good at hematocrit, okay, again, which is just how many red blood cells we have in our blood, okay, now we're going to compare that to how many hemoglobin molecules we have, period, okay, and we just do this as a ratio. So to calculate a hemoglobin ratio, we take what is called a packed cell volume, okay, the packed cell volume, PCV. Okay, this is your hematocrit because these cells that we're talking about are your red blood cells. So we are going to compare your hematocrit to your hemoglobin. Okay, so we're going to tell you how much hemoglobin you have. We're going to tell you what your PCV is, and we just want you to calculate a ratio. And again, we kind of made special note that your hematocrit is just your PCV. This is the same thing. Okay, now here we go. Here's our first example. So let's see, if we have a PCV of 48 and our hemoglobin is 16, okay, then our ratio would be 48 to 16. And we are always going to reduce this with our lowest common denominator. Okay. The easiest way to do that is just to divide these two numbers. Okay. So 48 and 16 will give you a 3-to-1 ratio. The 3-to-1 is something that you're going to see quite a lot because this is your normal ratio. Anything higher indicates that you don't have enough hemoglobin in your blood. Ratios lower than the 3-to-1 indicate that you have more hemoglobin present than normal. And it's really all about oxygen carrying capacity. Okay, so if you have a higher than normal ratio, then your oxygen carrying capacity could be suffering. If you have lower the normal ratio, then your oxygen carrying capacity is very good. So we've got another chart to fill in. Go ahead, take a minute, pause your video, do your math problems here. Remember, and pay attention, right? So this column is your PCV, this column is your hemoglobin. Do not flip these, okay? Do not flip these, you're gonna get all these wrong. So we're doing PCV compared to HB. We actually did the first one already. Remember, we did 48 into 16. Okay. All right, pause your video, do the rest, come back, check your work. Okay, let's check our work. All right, so we'd already done the 48 over 16. It's 3-to-1. Our next one, 44 over 16, gives us 3.1 to 1. Okay. Notice this is not a whole number, and that's perfectly okay. Do not round to the nearest whole number, okay? Do not round to the nearest whole number. Our next one is 40 over 8, which gives us a 5-to-1 ratio. 20 over 60 gives us 3-to-1 ratio. And 60 over 22 gives us 2.7-to-1 ratio. Okay? So now that we've filled in our chart, let's figure out what it's telling us. All right. Describe the ratio of PCV to hemoglobin for healthy males and females. Our chart said the males was a 3-to-1 ratio and the females was a 3.1-to-1 ratio. Okay. Why was the female ratio just a tiny bit higher? Remember, we talked about males just having more blood. females tend to lose some of that blood during menstruation and are a little bit more prone to iron deficiency anemia and things like that. So that ratio is just slightly different. But here, notice that these are different, right? 3 to 1 and a 3.1 to 1, right? So if you had rounded this, these would have been identical and you would have lost valuable information there. All right, describe the ratio for a female with iron deficiency anemia. Okay, so if our female does have full-on iron deficiency anemia, we kind of alluded to it up here, but if it's official down here, notice that we've jumped to a 5 to 1%. Okay, so oxygen carrying capacity is altered here, right? We're not quite as good. We don't have as much hemoglobin as we would like to carry around all those oxygen molecules. What are some of the side effects of iron deficiency anemia? That's fairly common. A lot of people know somebody with this type of anemia or could suffer from it themselves. One of the common symptoms is you're very tired all the time. Why are you tired all the time? Well, you don't have quite as much energy as you would like to. Well, what's one of the requirements for making energy in your body? It's oxygen. So if you're not carrying around as much oxygen as you would like, then you are going to be tired because you aren't going to be making as much ATP as you would like. All right. So is our patient female with iron deficiency, is she deficient in hemoglobin? Yes. Yes. All right. Male with polycythemia, is he deficient in hemoglobin? No, his ratio was just fine, and our female Olympic athlete, she was also just fine. Okay, in fact, if we go back to our chart, okay, if we go back to our chart, the male with polycythemia, he had that that golden 3 to 1 ratio. The female athlete actually has a lower ratio, 2.7 to 1, meaning that her oxygen carrying capacity is even higher than normal, which should make sense. Olympic athletes are very good at like endurance training and things like that, and their body's very effective at carrying that oxygen around the blood to use it properly, and so this lower value is not indicative of a problem. Okay, so that's something that confuses students a lot. They think, oh, the higher the ratio, the better, and that's just not the case here. The higher the numbers, the higher the ratios with this type of calculation is actually kind of a negative thing, while the lower the ratio here could be a better thing. Okay? And again, that 3.1 is normal, or 3 to 1, excuse me, and that 3 to 1 ratio is normal. All right, so we went through all these. All right, last but not least, conditions that decrease or increase hemoglobin concentrations. For decreasing, it could be things like blood loss, the anemias, cancers, okay? Anything that would cause you to physically lose hemoglobins or not even make them in the first place. Anything for increasing hemoglobins, so you would increase blood cell production. So polycythemia is just the increased production of red blood cells straight out. Lung diseases, we've talked about not being able to do gas exchange like we would like to, and so you could end up cranking out more red blood cells as well, and that would increase your hemoglobin also. Okay, so that concludes our discussion on hematocrit and packed cell volume.